Hello and welcome to this presentation on infection protection, talking about safer sex. So my name is Emily and we are going to go ahead and get started talking a little bit about what peer education is, and then we'll dive a little deeper to talking about our script for today. So to start with, peer education is a group that I am a part of. It's a group of BGSU students who go out to different organizations, different departments, different offices on campus, and we give presentations on health and wellness topics. So infection protection is one of our topics that we talk about, but we also talk about topics relating to sleep, relating to nutrition, relating to healthy relationships, alcohol and other drugs, and there's a whole variety. So if you're interested in learning more about these presentations, you can feel free to visit the BGSU Wellness Connection website. Additionally, we have some information there because these presentations are typically given in person. However, we also have these online resources as well. So if you're interested in requesting an in-person presentation, you can go to the Wellness Connection website as well. So we're going to go ahead and just dive in with the purpose of this presentation. So the purpose of this presentation, we're not assuming that everyone who watches this is sexually active or even has the same sexual orientation. Our goal is that this program is valuable to everyone regardless of sexual experience. We hope that you can use the information presented today for yourself presently, in the future, or to share with friends, or to simply increase your knowledge of safer sex. So we'll be discussing some things that you may or may not be aware of, some things that you may or may not agree with, but just being respectful throughout the presentation. So we're going to begin just talking about a few acronyms that I will be using throughout the presentation and just defining those. So the first two that we're going to talk about is an STI and an STD. So an STI is a sexually transmitted infection, to where an STD is a sexually transmitted disease. So an STD is the most commonly used term for infections that are transmitted through sexual contact, and people who become infected don't always have to experience symptoms or have their infection develop into a disease, so that is where the more modern term of STI comes from. And then two other terms we have here would be HIV and AIDS. So HIV stands for Human Immunodeficiency Virus, and AIDS is an acquired immunodeficiency syndrome. So HIV is a virus that may cause an infection, but AIDS is a condition or a syndrome. So being infected with HIV can lead to the development of AIDS, and AIDS development is when HIV has caused serious damage to the immune system. So we're going to start off here with an activity. So this is an STI risk continuum. So I'm going to give you a sexual act, and you have to define it as either high risk, low risk, or no risk for getting an STI. So I will go through and read some of these different things, and you can categorize it. And in this activity, our definition of sex is any intimate activity where one could be exposed to another's bodily fluids, including oral, vaginal, or anal sex. So as these different sexual acts flash onto the screen, deciding if it's no risk, low risk, medium, or high risk. taking a second here to notice if any of these surprised you, if any of them are different than what you thought, or if a lot of them are the same as the places that you thought they would be. And so sexual acts can be combined into different categories. So we'll talk a little bit about unsafe sex. So that would be our higher risk activities. So it puts you at a higher risk for STI transmission. So that would be having unprotected sex, sharing needles, or anything like that. Then there's safer sex. Safer sex means sex where one's risk for STIs and pregnancy is reduced. This usually occurs by using barriers during sexual activity, so like condoms or dental dams. But some STIs can be in areas that are not covered by a barrier, and there are some STIs like herpes or HPV that can be spread just through skin-to-skin contact, but using a barrier will still make sex safer than not using one at all. And then our last category here would be safe sex. So the only safe sex is abstinence, which is the only 100% effective way to reduce one's risk for STI and pregnancy. So we'll talk a little bit about that, but we will also talk about safer sex, which is what we talked about in some of the ways that you can keep yourself safe during these acts. So STIs can be passed from one person to another in various ways, which we'll talk about. One point to add here, as we just talked about all these high risk, these low risk, these medium risk, and no risk categories, another way that an STI can be passed from one person to another would be through sharing sex toys. So when using sex toys, it's important to understand how to keep them clean and how to prevent STIs between partners. If sex toys are shared, it's important to always use a new condom on your toys and to always use a condom on a sex toy if you're switching from anal to vaginal or oral sex. Another note to add would be that monogamy means having one sex partner over an extended period of time. However, many people practice serial monogamy, which is having one sex partner for a given period of time, which means they could have multiple sex partners over their lifetime. So it's important to understand how STIs can be transmitted throughout that time. And then even if you're in a monogamous relationship, it's important to use barriers during sexual activities to ensure that you are having safer sex. And it's important that both partners are tested for STIs before deciding if engaging in sexual activity without using a barrier is right for them. So one barrier that could be used would be a condom. So we're going to talk about those for a little bit. So there are different types of condoms. And then there's also some other barriers such as dental dams, which we will talk about, which would be used for oral sex. So first, thinking about how do you open a condom? So some of the improper ways might be using teeth, using scissors, or any other sharp object. Condoms come in several different sizes, shapes, textures for anyone who feels that they are too big or too small for the average condom. There are also options for latex condoms as well as condoms made without latex for anyone who may have a latex allergy. And then we're going to talk a little bit about mixing lubricants with condoms. All oil-based lubricants will dissolve a latex barrier. So this could include Vaseline, massage oil, baby oil, any lotions, or any other oil-based lubricant. So it's important to check the labels on your lubricant materials to make sure that they are either water-based or silicone-based. And if they are silicone-based, like many lubricants found in lubricated condoms, making sure that they are considered latex safe or latex compatible. So some examples of water-based lubricant could include KY, Astroglide, Wet, among many others. Always being sure to just check the labels on these. And again, the reason why this is important is if you were to use Vaseline or you were to use a lotion or a baby oil or something like that on a condom, the repeated friction of the condom against the skin will actually degrade the latex and it will break. Another option for a male condom would be to use a flavored condom. So these should only be used for oral sex, as the flavoring can be an irritant if it's used in a vagina or in an anus. And they may also use non-lubricated condoms with a flavored lubricant if you don't want to purchase a flavored condom. And then stay away from lubricated or spermicidal condoms because they don't taste very good. And also a spermicide can be an irritant to tissues that are found in your mouth as well as in the vagina and the anus. Another option would be an internal condom or a female condom. So a male condom would be considered an external condom, to where this one actually goes inside of a vagina. So do not use the internal or the female condom with a external or a male condom because the two of them together will cause them both to fall off, to slide, to break because of the latex rubbing up against the latex. And then our last option would be a dental dam. So this is used for safer oral sex. So it could be oral to a vagina, oral to an anus, And always keeping one side towards you and one side towards your partner. Don't flip it over. That kind of defeats the purpose of using one. And you can also create a dental dam by using a external or a male condom, cutting off the tip and then cutting down the middle. So all this is it's just a square or rectangle piece of latex that can be laid over the area. And as we mentioned in the beginning of this presentation, we understand that not everyone here is sexually active or has the same sexual orientation. So we'll be discussing proper steps on how to use a external condom, but we understand that not everyone uses an external condom as their choice of a barrier. However, the information that you will gain from learning the proper steps to safely put on this condom can be used for other barriers as well. So taking a second to think about what are the steps to putting on an external condom, seeing how many of them that you may know. You may know a lot of them, you may know a few of them. That's okay, we will go through them again. So just taking a second here to reflect and maybe write down those ones that you know. And then thinking about how many you came up with, we actually have 17 steps to putting on an external condom. So I'm going to put them up here, maybe looking and seeing what steps you maybe missed or what steps may be in the incorrect order. So the way that you're going to put on an external condom would be by checking the expiration date and making sure that the condom has an air pocket in the center. So a good condom will always have an air pocket in the center, and they're printed in 5 years in advance. So it's a good idea to check the expiration dates of your condoms on a regular basis and throw away any that are expired or very close to their expiration date. And if a condom is used close to its expiration date, check to see if the condom still has an air pocket. If it does not, throw it away. And the color and texture of a condom can also tell you if it's expired. So a expired condom will look more yellowish. And then this doesn't just apply to a external condom. This could apply to any barrier method as well, checking the expiration date. The next step would be arousal and foreplay, then erection, then pushing the condom to one side of the package and opening carefully along the perforated edge using your hands, not using any scissors, not using teeth, not using anything sharp. And then being aware of fingernails, jewelry, anything like that. And then visibly inspecting the condom for any obvious holes or perforations to see if you're about to roll the condom on the correct way. All condoms that are lubricated should feel smooth, so if your condom ever feels sticky or like sandpaper, it's probably old, so throwing that away, getting a new one. And then our next step would be to dab a tiny amount of water-based lube inside the condom or on the tip of the penis, remembering that oil-based lubricants will break down the latex and will cause the condom to break, and being careful not to add too much, otherwise the condom could potentially slide off. The next step would be to pinch the top of the condom to create a space for the ejaculate to go. So if you do not do this, so if you don't pinch the top of the condom before rolling it onto the penis, then the ejaculate will have nowhere to go, and it will likely cause the condom to break once ejaculation occurs. Our next step would be to place the condom with the pinched tip onto the top of the erect penis, and then rolling the condom all the way down to the base of the penis. So if a condom is not all the way rolled down to the base, it could expose STIs, as a condom is the only way to protect the area that they cover. And some STIs can lie all of the way at the base of the condom. Some may even be in areas not covered by the condom, but by using a condom, you're reducing your risk of STIs more than not using one at all. And then if you accidentally put the condom on upside down and it won't roll down the penis, making sure to throw the condom away and getting a new one. Don't flip it over and use the same one, because there's already pre-ejaculate or pre-cum on the tip of the penis, which would now be on the outside of the condom, and that carries enough sperm to cause pregnancy or other transmission of an STI. The next step would be to smooth out any air bubbles, then consensual sex, ejaculation, and then being sure to hold the base of the condom and withdraw the penis before a loss of erection so that you don't lose the condom inside the partner, which could increase the risk of STI or pregnancy. And then taking the condom off carefully away from your partner. So gently removing the condom so that the breakage or spillage does not occur. Taking it off away from your partner reduces the risk of them coming into contact with any ejaculate that may spill. Next, throwing the condom away in a trash can. Do not flush it down the toilet because condoms are not water soluble. They do not dissolve in water. So if you flush them down the toilet, they will eventually clog your toilet. So our next step would be to wash your hands with soap and water, ensuring that any bodily fluids may transmit STIs and are washed away. And then repeating these steps for each and every sex act, including whenever you decide to change acts, so such as changing from oral to vaginal, or changing from anal to oral or any other change that you may make. And then using a new condom each time, making sure to put it on correctly before switching between types of sex. And then remembering that before any of these steps can even take place, the most important step is to receive sober and enthusiastic consent from your partner. And then just going back, we're going to finish up with a little bit of a game talking about some of the common misconceptions and common questions about STIs as well as other safer sex practices. And just remembering how we have talked throughout this presentation about the risk of spreading an STI. So even sex once without a barrier could potentially spread an STI. And most people with STIs do not have symptoms, so you could be passing it on even without knowing. So it's definitely important to get tested and to have your partner tested and to practice these safe sex practices. So our first question would be, what do HIV and AIDS stand for? So we talked a little bit about this at the beginning, but HIV would be a human immunodeficiency virus, and AIDS can be acquired when HIV goes uncontrolled in the body for a period of time, and it turns into an acquired immunodeficiency syndrome. Our next question is, what is a window period? So a window period is from the time of initial infection until the detection of antibodies, which are the proteins that our body uses to fight off the virus. And so this would be specifically important for HIV. So this means that someone could test negative when taking an HIV antibody test, but really be positive. So if testing within the window period, because their body has not yet produced the detectable antibodies, so like when it first happens, you're not going to detect positive. So during the window period, the HIV antibodies may not be detected for up to 6 months. So most people will produce a detectable antibody within 3 to 6 weeks. However, some people take longer. The majority of people will produce detectable antibodies within 3 months after the infection, but a small percentage of people may take up to 6 months. So this is why we refer to HIV as having a 6-month window period, because it may take up to 6 months for you to test positive after acquiring it. And then, what bodily fluids can transmit HIV? So this could be transmitted through blood, semen, vaginal secretions, as well as breast milk. Breast milk is rare, but the highest risk for transmission is through infant consumption. There are also some other ways that HIV can be transmitted through fluids that you probably would not be touching, such as like a synovial joint fluid, brain fluid, spinal fluid. Most of us don't come into contact with these fluids, so we're only worried about the blood, semen, vaginal secretions, and breast milk. A common misconception when we're talking about ways to transmit HIV would be through saliva, so you actually cannot transmit HIV through a normal amount of saliva produced. Our next question would be, what are some behaviors that increase your risk of contracting HIV? So these could include any type of unprotected sex, oral, vaginal, or anal, the injection drug use, so sharing needles, as well as vertical transmission, so from a mother to a child, either during childbirth or breastfeeding. Our next question would be, what does secondary contact mean? So if you touch an area that has a primary infection, considering like the genitals or an anus, and then you touch another area of your body where there's a mucous membrane or an open area to the skin, so maybe you have a cut, a scrape, anything like that, the STI can actually enter through that second area that you touched, so that would be a secondary contact. Our next question would be, what is the most commonly diagnosed bacterial STI in the United States? And what is the most commonly diagnosed bacterial STI on BGSU's campus? So in 2017, a total of 1.7 million cases of chlamydia infections were reported to the CDC. And then in 2018, 2% of BGSU students reported testing positive for chlamydia in the last 12 months. However, this number could potentially be higher because of people not tested as well. Our next question is, what does asymptomatic mean and why is it important? So asymptomatic means without symptoms or showing no signs of disease. So nearly all STIs are asymptomatic. It's the number one symptom of STIs is no symptoms. So therefore you can't tell if you or your partner has an STI just by looking. You actually have to get tested outside of your window periods to make sure. And then what are 2 very serious complications of leaving an STI untreated? And these could include if you leave an STI untreated for too long, it could lead to infertility or it could potentially lead to death. Our next question is, what does the term opportunistic infection mean? So an opportunistic infection is one that is caused by pathogens that typically do not attack people with a healthy or fully functioning immune system. So the opportunistic infections attack the immune system of those who have a lower or an immunocompromised immune system. And so these are people with HIV due to their decreased function of the immune system as a result of the virus. What STIs are curable? So in general, any bacterial STI would be curable by antibiotic use. So some of these could include gonorrhea, syphilis, chlamydia, and then what STIs are incurable and why. So in general, an STI that is caused by a virus is not going to be curable, but it can be treatable. Some of these would include HIV, as well as herpes, HPV, and chronic hepatitis B. So, however, in young, healthy women, the body tends to rid HPV within about 2 years of infection. So, there are many treatments available for many of the viral STIs to make them more bearable, but none of the treatments are going to make them go away. Our next question would be, why are oil-based lubricants harmful to latex condoms? So, oils break down the latex and cause the latex condom and other latex barriers to break. So our next question is, why would a person want to leave room at the tip of the condom, and what is that called? So when you pinch the top of a condom, that is called the reservoir tip, and no room at the tip of the condom might mean that the condom would break during ejaculation. And then we just have 2 more questions here. So our first question would be, name 2 sexual activities that are considered high risk for STI transmission. So the 2 that you may have chose could include sex under the influence of alcohol or other drugs, anal sex without the use of a barrier or lubricant, performing oral sex without a barrier, vaginal sex without a barrier, or swallowing semen. Our last question is, what is the only 100% way to reduce the risk of STIs and or pregnancy? That would be abstinence. So in conclusion here, remembering that the decision to be sexually active is a personal one and that it's okay to not be sexually active. According to the American College Health Association 2018 survey, 29.1% of BGSU students have never had a sexual partner, and 51.7% have only had one sexual partner within the last 12 months. So when and if you decide to be sexually active, we ask that you remember to respect and protect yourself and your partner or partners by talking about sex first, practicing safer sex practices, and always remembering to receive sober consent. Just another point here that most methods of contraception, for example, like the pill, IUDs, birth control shots, the patch, diaphragms, vaginal rings, birth control implants, or sterilization, those are going to protect you against pregnancy. However, they do not protect against STIs. The ways that you're going to protect against STIs are going to be those barrier methods that we have talked about. So if you have any further questions about this topic or any other topic relating to peer education and health and wellness, feel free to reach out to the BGSU Wellness Connection. We have our information here, or if you're interested in becoming a peer educator, feel free to visit our website as well. And have a great day.